Good morning to you all. This is our 6th episode of the Women's Show on Civic Space TV, and I am excited to have two amazing women joining us on the show. Today we are discussing a topic which the society that we live in usually shuns. So a topic that at times when you bring up, people say that one is pretending or one is high-end. At times it has been said that it's a disease for white people and Africans don't suffer from this, and yet it's a reality within our country, it's a reality within our society. The conversation we are having today is a conversation that ranks Uganda one of the top 6 countries in Africa with this challenge. But also with this challenge, and as glaring as it is, Uganda's budget only provides 1% allocation towards meeting this need. And yet it is also stated that approximately 25% of people in their lifetime shall experience this situation. And so today we're going to be discussing mental health. Today we're going to be talking about the mental health challenge in Uganda. And I hope that it is a conversation that everyone shall sit through up to the end, because all of us are possible candidates for our mental health situation, or even if we do not have it, one or two of our colleagues or family members is a potential candidate or a potential person that may have to deal with a mental health situation. And so joining me on the call or joining me on the show today are two ladies. One is Grace Obalim, and the second one is Gladys Ananura. And so I'm going to invite Grace to introduce herself before we delve into the conversation.
Thank you. Thank you so much, Isabella. And it's really great to see you after a long time and be on the same discussion with you. It's a privilege. My name is Grace Obalim. I'm a clinical psychologist by training, a practicing mental health expert. I work with an NGO that is called TPO Uganda as the mental health and psychosocial support advisor. That NGO provides mental health services in about 38 districts in this country for both refugees and non-refugees community. I also double as the chairperson for the Uganda National Mental Health and Psychosocial Support Working Group, which is a network that brings together all NGOs, development actors, and institutions that provide mental health and psychosocial support services in this country. It's a network that was established in 2019. This is my second term of chairship. I got re-elected back about a week ago. So we normally hold discussions around mental health and get reports from implementing partners and what they're doing in the community on a basis of once every month. Every last Tuesday of every month, we have meetings. We used to have it physically, but because of COVID, we now do it virtually. I'm a full-time employed staff with TPO Uganda. I advise on all mental health activities and then also support the different ministries under government on system strengthening and advocating for mainstreaming of mental health services into that different thematic area. Thank you so much, Isabella. That's a brief introduction about myself.
Thank you very much, Grace, and it's an honor to have you on that show. Next, I'll invite Gladys to join us, and please introduce yourself. You're welcome, Gladys.
Thank you, Isabella.
Yes, Gladys?
I am Ananura Gladys, a member of Uganda Counselling Association in this country. I am Ananura Gladys, a member of Uganda Counselling Association, an association that brings together people that the counselors in this country, as well as everyone that offers social support system or psychosocial support system to people. I also work as a counselor with Chambogo University on a part-time basis. I'm on contract, and I offer my services to many more people other than the university students, the staff, their families, and so on. I'm glad to be part of this and to work with both of you. Thank you.
Thank you very much. And Grace and Gladys, once again, you're very much welcome to the show. So getting into the discussion, mental health is one of those, it's one of those conversations, or it's one of those aspects that is quite important to our lives. And yet we probably pay the least attention to our mental health. I remember about 2 or 3 years ago, I walked into my physician's office, and I remember we had a conversation, and then he told me, "You're depressed. You know, you're depressed." And I told him, "No, I'm a happy person. I cannot be depressed. It is impossible that I am depressed." And then about a few months ago, I remember again, I had to go and see a psychologist, and I struggled with a lot of people, and I told them, I can't go and see a psychologist because there's absolutely nothing wrong with me. And it took me a lot of time to get convinced to go and have sessions with a psychologist. So let's start from the basics of mental health, because even we who should be having a certain amount of energy and comfort around mental. Is it possible for you, Gladys, to walk us through what mental health is? When we talk about mental health, what is it?
Thank you very much, Isabella. Mental health is a diverse issue that most of us do not easily get to know, because we always think that for someone to be mentally ill, they either have to present with difficult situations like psychosis, they are out of their mind, for them to be named as mental ill people. But mental health is diverse. I like the fact that you mentioned about depression. A simple thing like that is part of mental health. It presents in many things like stress. It presents in, it's basically the way the way we handle our emotional stability. When our emotions are not stable, then we present with mental illnesses. They cover even epilepsy, which Ugandans think it is not a mental health issue. They always attach it to witchcraft, to spirits, to something else, but all those things are a mental health illness. So we need to know that it is with us, that it has been with us, and it starts slowly before you basically get out of your mind. And each one of us has an issue, a mental issue, but it only gets escalated by the circumstances around us, the stress levels around us, the way we handle emotions can escalate mental issues within us. But all of us are capable of having a mental illness. Thank you. I submit.
Thank you very much, Gladys. And you know, it's one of those things that we need to normalize. It's one of the things we need to keep telling ourselves, that all of us are potential candidates in the mental health unit. And yet, you know, again, it's one of those things that even if we know that we are all potential candidates, none of us is willing to agree that we are potential candidates. But bringing Grace in, before we delve into the details of mental health, there's a lot of stereotypes around mental health. And I think that stereotype also extends itself into how government policy, but also how government budget allocations finally make their way into the mental health sphere. Before we get into the details of our mental health challenges, what are some of the frameworks that have been established to address the mental health challenge in Uganda?
Thank you. Thank you so much, Isabella. I must say you are a very courageous, strong woman. Even as I was growing up as a young university student, you have been among the ladies that I admired their courage and strength. And listening to you share about your experience with back and forth on how to manage your emotions and handle signs and symptoms of depression, it's really amazing and it's very encouraging. Not many people come up to share about their experiences with dealing with the mental health challenges. And that is, I want to compliment you for that. And I must say that takes strength and courage. Next time, if you have time, invite me. I will share with you my mental health issues, managing and dealing with emotional abusive relationship and having to live with an imposter to a point of almost getting married. I'll share that another time. Yes.
We'll definitely invite you.
I'll share that another time. Yeah, but I want to make a very simplified understanding of mental health before I get into the framework. Isabella, mental health is literally your ability to be able to understand your strengths and weaknesses, and you being able to cope with the life challenges that you're faced with, and then live a productive life for yourself, your people around you, and your community. That's what mental health is. It has nothing to do with sickness. Let's be clear on that. Your ability to be able to function, deal with life issues, the challenges that you're faced with, and then you live a productive life for yourself and the people around you. Now, that's mental health. However, on the other end, we have what we call mental health disorders. Now, mental health disorders, these are diseases, these are sicknesses that affects the function of a person's mental health. And that is what we are addressing today. What are those mental health disorders? What are mental health disorders? The mental health challenges that we have in the country. I must say that Uganda, I like giving credit to where it's due. Uganda has made quite steps into addressing mental health challenges. As I speak right now, in 2015, the Mental Health Act was passed by the Parliament. And as I speak, it was approved and appended to as an act that directs and support into the mental health response, prevention, treatment in the country. That is a plus. I interact with global networks. There are some countries that don't even have a policy or an act that guides that. So for us as a country to be having the Mental Health Act passed, that's a good plus, which happened years ago. And direct focus in that Mental Health Act is integrating mental health services into primary health care. To me, that was the best of it all. Because if the government can make that operational and set up systems into the primary health care, because that is part of the Mental Health Act, that will provide and bring services, and will have a clear framework and operational system where people can get services. The second framework that I would like to bring to our attention is that it's under review. We have, with the guidance and direct supervision from Ministry of Health, the Division of Mental Health and Substance Unit, we are revising the Uganda Mental Health Strategic Plan, 2021-2026. We are looking at a 5-year strategic plan, yes. Now, when you look at this strategic plan, it's an amazing document, Isabella. It's looking at setting up systems and structures as low as Health Center 3, where people can be able to access mental health services. And it clearly spells out and gives the focus of Uganda as a country, where it wants to go into addressing mental health issues. Now, these are the two frameworks that I know. But other than that, there are a number of frameworks. For example, the WHO mental health statement on mental health, with the focus at looking at prioritizing mental health as a health challenge for every person that comes to receive general health care. Now, these are some of the framework that we have, but Uganda has made steps. However, we still have more steps to make. And that takes me because there are a lot of stereotypes around mental health disorders. There are a lot of misunderstanding. There are a lot of information gaps. Now, because of that, even these frameworks that are set up, implementing them are not possible because people do not have understandings around this. So, looking at addressing these challenges, there are some lower level frameworks that have been set up. One of them is the Uganda National Mental Health and Psychosocial Support Working Group Network that has been set up. It has membership of over 68 partners from these countries, both NGOs, local and international NGOs, institutions of learning, and development partners. This is a network that mental health actors and implementers come together and discuss, and then they share lesson learned, and then they come with activities. That is another framework. Now, this framework escalates down to district levels. We have had a challenge to escalate this to districts that are not refugee hosting districts in Uganda. But all the refugees hosting districts in Uganda have this field level, district-based mental health and psychosocial networks, working group that meets on a monthly basis. And they provide reports to the National Working Group. The National Working Group, where I'm the chairperson, provide reports to the Ministry of Health, the Department of Mental Health and Substance Unit. Now, these are frameworks that are being set up. Other than that, there are very many talking points. I was very happy to hear Gladys says that she's a member of the Uganda Counselling Association. That is also a framework set up to address and respond to mental health and psychosocial issues. This is a network of professionals from different walks of life. And they have done a lot into the response of COVID. I'll give a bit of the activities that we have been doing with them later into our discussion. The next one is we have Uganda Psychiatric Association. This is an association of professional psychiatrists. They do bi-weekly webinars where they discuss issues. They do continuous learning where they discuss issues around mental health. They share learning. They also direct discussions and policy reviews. And then we have another network that is called the Uganda Social Workers Association. These are all frameworks and networks that are around mental health. As I speak to you right now, we have tabled a request on the table of the PS, Ministry of Health. We want the clinical psychologists, Makerere graduates at least 2 or 3 clinical psychologists in a year. In the past graduation, they graduated 3 that I know of because they are my staff under TPO. Now we have this group of mental health experts that do not have a scheme of services and they do not have a professional body that they belong to. Now, under the National Mental Health Working Group, we have stabled this with the support of some clinical psychologists and psychiatrists from Butabika. We have tabled this request to the table of the PS Ministry of Health, asking that she revise the scheme of services for clinical psychologists and have them registered under a ministry so that they are guided, their professional work is guided. Then lastly, we have Butabika, which is a national referral hospital, as a framework and a system in responding to mental health. It's a national, but at district level, unfortunately, a structure and a system is that every district hospital is supposed to be having a functional mental health unit. Isabella, these are structures that are set up, but I'll give you sad news that when COVID struck, my country rushed and made sure all the mental health units in the different districts were turned into COVID treatment center. Now,
and what was going to happen to the stress levels?
Exactly. You see, so these are some of the issues, but I want to stop there, Isabella. Thank you so much for that question.
Thank you. And maybe at this time I'll bring in Gladys, because as you spoke, I was like, wow, we have all these structures. And Gladys says she's a counselor, but she also works at the university. at Shambogo University. And I know that universities are stress points. Universities are places where triggers could occur. I know that recently there was a conversation around LDC and how LDC has become a mental health trigger. So given the conversation that you have just had, the submission that you have just made, Grace, I would like Gladys to come in and talk to us about the realities of accessing mental health services, especially given that you work directly with a community that actively needs this support. Gladys.
Thank you very much, Isabella. Yes, the communities that we work with for students need mental health support. But most of them, like Grace said, the stigma attached to mental health does not allow them to come out and actually say they have an issue. It takes courage for someone to say, I have this issue, because like you shared, Isabella, at the beginning, when they are told that, you need to see a psychiatrist, I am a counseling psychologist, I've only done assessment, and the assessment shows that your depression is not mild, it is tending to severe. I need an assistance of a psychiatrist. They will not easily get into the hospital for support. I can give examples here. I had a student, when I called the parent and said, this student is mentally sick and needs support from the family and from a psychiatrist for them to be able to heal. They cannot coherently attend lectures. They cannot be able to function properly. They are actually beating up colleagues, and so they need to be hospitalized. The parent said, no. The student was already in an ambulance being taken to Butabika, and the parent said, no, not to Butabika. No, it can't happen to my child. So some people have a problem with the name Butabika. And they feel like taking my child to Butabika is stigmatization. They will be named as mad people. And so I have resorted to working with the psychiatrists that have other clinics that are out of Butabika, like Dr. Basangwa, whom I always send my patients to, because people don't want to hear the word Butabika. Yes. Secondly, our students need support from their parents, from the family, to be able to heal. I handled a student who was depressed, and the family threw her out. She was a first-class student. But when she started not performing well, the first thing that parents think about is this child is getting into relationships and getting spoiled, and so they are not concentrating, not minding about the mental part of it, the toll that it brings to the student, even if they were in a relationship that went sour. Grace is planning to share. It alone brings a problem, and they can't perform, like Grace said. Your mental health, when you're not able to handle emotions, they can draw you down mentally. So some parents are not able to support. They withdraw school fees. They say, I will not pay for you. You went and got spoiled. You got into wrong company, not understanding that my client was suffering from depression. Some people have gone on to cut off services, like if they were being supported by an organization to pay for them school fees, the organization says, no, since you're mentally ill, the fact that they have read documentations of Butabika Hospital with what they have done, they are like, this one has gone cuckoos. we can't support this person, and they withdraw,
Yeah.
which is not right. That's all I can say.
Yes, but before you go, just a follow-up question is around the issue of affordability of affordability in terms of mental health. Because if I have malaria, I can walk into any random clinic.
Mm-hmm.
Can the average person afford mental health care?
Okay, thank you. What I've seen around with that, most people are not able to support themselves. I remember when I sent someone to Butavika and they said, yes, I've got the medication, but I don't think I can be able to buy this medication all through. And that has led to wrong adherence of the clients. They will adhere for 1 month, and if the treatment is for 3 months, they will not be able to continue with the medication. Some of these drugs are expensive to the students, and because parents don't want to support, they've thrown them out. It's all about them to be able to get this medication. And it's not easy. And like Grace said, some hospitals do not have mental health systems, and or they have to go to places like reaching out to Mulago where the services can be cheaper, reaching out to Butavika where the services can be cheaper, and it's not easy for them.
Okay, and I don't know, maybe I will bring Grace in on this note to say that.
Yes.
To say that, and I have another question that I was supposed to send your way, Grace, but before, but I'll send you both of them. So if we are talking about mental health and we are saying that it's such an important aspect of our lives, it's central to our working, isn't it a paradox that only 1% of our health budget is dedicated to mental health, given that that affordability is a big issue, but also given that we have a young population, so how do we talk mental health? So within the structures and spaces that you sit in, what are the conversations around mental health in regard to affordability? But also, question number 2 is the issue around the COVID pandemic. Okay, so COVID has come and COVID has become a stressor, and it has become one of those things that is just going to spiral the already bad numbers or around our mental health situation in the country. And so with COVID, of course, there is the issue of stress. There is the issue of the fact that people cannot go out. You're stuck at home. People cannot meet families. People are losing family members, and they cannot even have closure because government is not allowing people to see bodies, even if that is contrary to the World Health Organization standards. But then also you have the area that we rarely talk about, which is mental health, COVID, and the realities of unemployment. Okay, so where is the safety around that? Because if people are falling off, the cliff, where is the protection of employees if their employers can fire them on grounds of mental health? And the reason that I ask that question is because in the last pandemic, a friend got fired because she had a mental health breakdown, and it is sad that you have a lot of workspaces that do not recognize mental health disorders as any other medical issue, that you can go and give birth and come back. You can be on sick leave for malaria and come back. But as soon as you're off to Butavika, we can no longer trust you with our work. So over to you.
Thank you. Thank you so much, Isabella. As you are speaking, it's very saddening, because everything you're saying are truth, and the facts and the challenges that are out there. I want to start from the note where you stopped from. Where is the safety? Where does a person strike from? Honestly, right now, Uganda looks at suicide. Having suicidal tendency or suicidal attempts, or one losing life as a result of suicide is taken as a criminal act. I do a lot of community mental health training and stakeholders, and my focus has been police. For the past 1 year, I've been doing a lot of mental health training with Uganda Police under the SGBV Respond and Prevention. And I keep saying suicidal thoughts and suicidal attempts, this is a clear symptom of a mental health disorder, that a person's perspective of life has not only changed from totally no positivity or no hope in them to live, but there's something, I like using play term, I tell them there is something that is chemically not right, that a person's mind is not thinking straight and they cannot control it, and the best option is suicide. Isabella, by the time a person starts to think or contemplate suicide, that is the best and the last option they have. And it's not intentional, and it is not a criminal act, because they are not committing any offense. The challenges, the emotional distress, the pain and the suffering this person goes through, unfortunately, me and you, Isabella, might not be able to see it, because presentation of mental health disorders, it is only the person experiencing it that can explain it to you. I am a practicing mental health expert. I normally also don't just look at people and make diagnosis. I listen to the client. The client understands how they're feeling and what they're going through best. So where is the safety? Where is the landing spot? We need to start by looking at revising our policies first. Because you cannot tell me that my client that I've been seeing for 2 years on treatment of bipolar mood disorder, they attempt suicide, and then you take them to police and you charge them that it's a criminal act. So one thing that I would look at is policy advocacy. We need to advocate around mental health friendly policies. Policies that start to treat and look at mental health or mental illnesses as a disease, as a sickness, as a mental health challenge that need to be responded to within the primary health care system. It should not be responded to in isolations. And that is why people have a lot of stigma attached to Butabika.
Yes.
I almost felt up with my family when I one time mentioned and said, I want to check my brother into a rehab. Isabella, this is a functional man, a man who studied electrical engineering and graduated with a first-class degree from a very sound university from this country, but he has never worked a day of his life. He drinks and smokes, and when I looked at him, he is not even in the level of dependent, but he's in a level of addiction that needs very severe system program of rehabilitation. Everybody in my home were like, what is wrong with you? Isabella, you know a bit about my family. They were like, are you okay in your head? Because now you've studied this, you want everyone to be sick. And as I speak to you,
it is stopped. Carry everything to the hospital. Yes.
Exactly. It is stopped in discussion. Other than that, I want to share about my mom. In 2016, we lost my dad, a very crucial and influential man in the family. My mother sank into depression. By then, she was 70 years. Nobody noticed that. I was in Nairobi practicing, working in Kenya. I stayed home for 2 weeks, went back to Nairobi. The entire 2016, from January up to December, my mother started losing weight, started isolating herself, stopped going to church, stopped even interacting with the women in the community. And our home used to be a stop point for everybody. She started becoming very, very negative. When I came back in December, I noticed Mom started mixing names. When she wants to call me, she would call my other sisters or even call our grandkids, the nieces. I started noticing, she started forgetting where she has put things. Her phone is here. She started saying, someone has taken my phone. Where is my phone? She started forgetting, not even remembering that she has had breakfast. I told one of my elder brothers, I said, I need us to take mommy for a psychiatric evaluation because I think she's starting to have an old-age mental illness that is called dementia or Alzheimer. Everybody jumped in two arms, Isabella. This is personal story. The whole of 2017 up to August, we left my mom like that. My mother lost more than 65% of her weight.
Oh,
and then one of my brothers said, Grace, why don't you do what you want to do? Because you have the right to do it. Go ahead and do it. I consulted Professor Musisi, he's a psychiatrist in this country, and explained to him what my mom was going through, made him see my mom, and she was given a diagnosis of dementia. We put her on brain supplement and started treating her in a manner that we understand. I took my siblings through what my mother is going through. As I speak to you right now, Isabella, my mom's health has improved. The memory has improved a bit. My family has gotten to a point to appreciate, okay, what she went through, but it took us 2 years. I saw my mom gradually go down in front of me looking at it like this. Now, these are some of the challenges that is attached to mental health disorders. Why? Because the government has put its management into isolation.
Yes.
When people talk about Butavika, they speak about extreme mental health disorders. They speak about persons who have lost touch with reality. They speak about people who cannot talk for themselves. They speak about people who are having abnormal behaviors. But that is not true. Because mental health disorder affects everybody. The safety here is that, Isabella, each and every one of us needs to take addressing our mental health disorder as our own responsibility and our priority. Because it's true, there are organizations that don't care to hear about mental health disorder. I'm lucky to be working in an organization where I took 1 month off. Nobody cared to disturb me. My colleagues would call and come home to check on me. And I was paid full salary. And even our health insurance cover, the health insurance company was untwisted by my bosses and they accepted treating a mental health disorder. That is 1 out of 100.
I agree. It's actually rare. It's almost unheard of.
So we are in this space. Now, if I tie it to COVID, COVID has totally changed human beings. COVID, I normally tell people that COVID is a silent World War III with no bullets, no bombs, no firearms, no bullet, but it's worse than the world wars that we have had that has bullets. Because human beings, by definition, Isabella, we are social beings.
Yes.
We live by interacting, by talking, by being close to you, by seeking opinion, you know, by having proximity. Feeling touch, feeling hug, touching somebody, that is part of what makes human being different from animals, other than the cognitive part, the cognitive part of it. Now COVID came and took away the social being of a human being. Yeah. You cannot hug. I've not seen you for years, over 6 years, Isabella. If I'm to see you now, I'm not allowed to hug you or shake your hand, wave to you from far. Yeah. Exactly. You can't bury your person that you have lost. You can't see their bodies. You take your person to the hospital for treatment. The moment they're tested positive of COVID, they're taken to the treatment center, they take you back home. Wait for a phone call. You can't see them. The nurses or the doctors that enter the treatment rooms are dressed up, fully covered. You can't see a smile, you only hear a voice coming out of a figure that looks like a white presentation. This is where we are in now. What can me and you do? What do we have that we can protect ourselves? We need to take personal initiative, because the truth is, and I will say this in even any other platform, our government has failed us in addressing our mental health needs. Our bosses at different workplaces have failed us in addressing our mental health needs. Our families, loved ones, friends, relatives have failed us in addressing our mental health needs. It's because either maybe they don't understand what they can do, how can they help us? The fact of the matter remains is that very few people are out there that can help you address your mental health needs. Isabella, I have a practicing clinic here in Chigowa. If you come without you being referred or without you calling me, because I do a lot of pro bono services, if you call me and tell me I picked your number from here, I see you for free. But if you walk in, I charge 50,000 per session. Can a common Ugandan afford that money?
No.
They cannot.
No.
They cannot. Oh, I have checked with the private rehabilitation centers that are in Uganda. I've checked with 3. Isabella, do you know that they charge between 10 to 13 million for you to have a person for 3 months in a private rehabilitation center in this country? Can a common Ugandan afford that? Okay, leave alone a common Ugandan. Even a rich person who does not have understanding of what mental health disorders is, why is this person smoking weed or drinking excessively? Can they just put that 13 million like that? They cannot. Now, with the COVID situation and all the gaps that we have in addressing and responding to our mental health disorder, me and you need to take a responsibility to address our mental health disorder. 1, understand yourself.
Yeah.
Know your strength. Know your weaknesses. Know your ups and downs. Understand your flaws. Try to understand your emotions. Emotions of happiness, emotion of sadness, regret, rage, anger, frustration, revenge. Understand them and see, how do these emotions contribute to you? How are they affecting your physical health? How are they affecting your interactions with Isabella, whom you're planning a revenge against? Or anyone else that is close to Isabella? When you're able to understand that, you will be able to take appropriate decisions and protect yourself. 2, let us be mindful of what we take in. Isabella, I normally tell people, why would you sit and watch news that is reporting death, and then when you're done watching, you can't even eat food?
I know. Actually, I have a lot of friends who are going on social media detoxes because every WhatsApp group, rest in peace, like.
We need to be able to control what we take in. Pick information from approved source. Yes, the Ministry of Health might not be giving us all the statistics, but I'm better off with Ministry of Health telling me Uganda has registered 800 deaths than the social media that is telling me Uganda has registered 8,000 deaths. Because that will create fear. It will take away your strength of resilience. The unfortunate bit with stress is that when it comes, all the symptoms of that what you're fearing comes in.
All of them.
All of it comes in. Okay, so let us control. These are the affordability we are talking about, because these are things you can do for yourself. Control what you take in. What social media news do you read? With COVID, you just have to go on Google and check update on COVID, the world update on COVID. You will see the entire dashboard. Stop listening to I hear Gatariko Ifufu. I don't know how to pronounce that news. You hear over hotspot. You hear on the line. Come on, Isabella. My daughter almost got into severe depression for me in the first lockdown in this house. I was working from home. She would sit and listen to all the meetings I conduct. All the papers I'm reviewing for responding to COVID, she would be there, I would talk to her about it, and then added on with news. A 14-year-old girl, from nowhere she started. I came and found she plucked off the extension from the socket. I asked her, why did you do that? She said, I don't want to hear any noise in this house or even watch TV. I asked her why. She said, everything is about fear and dying and COVID. That's when it hit me and I realized my child is not okay. And when I started noticing, she had started eating only one meal. She had stopped going for her morning runs. Even doing the basketball game that she used to do in the compound, she had stopped doing it. All she does is sleep up to about 2 p.m., wake up, come lie on the chair and continue with sleeping. And then drink a lot of soda and take yogurt. And that was it. It is because of news, what you take in. So let us be able to control that and then have healthy conversations with people. Establish healthy relationships with people. Supportive, healthy relationships. Have people that care about you, people that will not ask you, Isabella, how are you? I'm fine. Okay. Have people that will ask you, Isabella, really, how are you? Those are the supportive, healthy relationships I'm talking about. Even though it's only one person or two, it matters.
Yes.
Because it will help bring you back to reality. When I said, but no, Isabella, really, how are you? The fact that I'll emphasize, it will keep, our brain is very dynamic. It will send you and you say, but Grace, by the way, I've not been okay. That is enough. That's what matters. Yeah. Create connections between you and your people and your children, husbands and wife. Have understanding between you. Now you're at home, you're in lockdown. There's no more work, no more football. You can't run away from each other.
You're there after each other.
You are there in the face of each other. Create a point of connection, okay? Have things that have positive communication, healthy communication. When you don't like what is going on, don't say, I'm tired of your behaviors. No, tell him, say, babe, this doesn't seem right with me. Do you think we can do something about it? Communicate your feelings, but as you're communicating, be mindful of how is it going to affect the other person. That's what is positive communication is all about. Because this will create a positive environment. And then finally, Isabella, let us pay attention to children's emotion.
Yes.
From primary to university, let us pay attention to them. Children are suffering in silence. Unfortunately, they don't understand what is going on with them. We sit presidential address, school is closed, effective immediately 8 a.m. tomorrow. Parents are full with cars at school, packing them with suitcases, going back home. You don't know what is going on in the mind of that child. Isabella, you're good with social media. I'm very sure you've seen how much rage, disappointment, and anger the young people are expressing on social media because of the people they're losing. There's one thing going on social media where a child said he wants to grow up to become a hangman. He wants to be hanging people who are embezzling funds, people who are involved in corruption. Because these are people who have eaten COVID fund and his parents died because of lack of oxygen and lack of health services. These are emotions that are there.
Yeah.
Children are losing parents and they tell them, your mom died because she could not get oxygen. My 15-year-old girl will not understand, how can hospital not have oxygen? So
yet
we need to pay
attention.
Yes. Yeah, it is all over, okay? Yes. So we need to pay attention to children's emotion. Let us watch the changes in them. I was speaking to a friend this morning. He wants to take his son to police. 20-year-old son who woke up one day and said, Dad, me, I don't want to study anymore. You know what I want? I want to be a taxi driver. This is a child who is an average performer, senior 6. He's a single father. He jumped out of his skin and said, Grace, I am driving this child to police. I told him I'm the one arresting you.
Yes.
This boy has been in senior 6 last year, March.
For 2 years and no one is explaining why he can't leave. But maybe at this time, let me bring in Gladys. 2 years, yes. And maybe let me bring in Gladys. Thank you very much, Grace. And the reason I bring in Gladys is because, again, she works within the context of an institution of higher learning. And we've talked about issues of affordability. We've also talked about issues of access. But we've also talked about, you painted the realities that students are dealing with on a daily. The other one that you probably forgot to mention is the situation where students are being told that they're the ones who brought COVID home. Okay, so when your grandmother dies, it is you who killed your grandmother. There was also a story in the newspapers of that student who went to the village and the family put the child in the bush for quarantine for about 10 days until they were sure that the child was fine, you know? But then also, I have been having conversations with a couple of friends of mine, and one of them was telling me of her brother who came back from school, and he was interacting, and then one day he was chatting with his friend, and the friend told him, so I've not been breathing properly. S2, I've not been breathing properly, so my parents are taking me to hospital. The next message he received, I am in ICU. In the evening, that's his desk mate. In the evening, I think the person who sleeps, his decker mate, was also saying, I'm going to hospital. Less than a few days later, ICU person passed away. S2, 14. And then that was the point in time that he now called my friend and told her, oh, one of my friends has died. I think I have COVID. You get? But in that entire time, that entire period, he was so stressed out. And then he began to say, I think I have given COVID to the parents. I think I have spread. He's 14. And so to Gladys, within the context of the pandemic, within the context of children, how do we address the issue of affordability? But also, how do we access the issue of access to services? For parents who are watching, where does the parent take their child? You know, where do we go if we can't go to, because even Butarika is overcrowded? So where do we go?
Thank you very much, Isabella. And thank you very much, Grace. All that you have shared is the reality. I am always on the forums with students. When they locked down, I had to follow some of the groups of my students to see whether they had reached home. And after reaching home, how were they handling? Some, like you're saying, some of them were received at home and they were told this house belongs to you alone until we know you're safe. Because Changopa had been identified to be one of the institutions where COVID had escalated. Whoever walked into the village was told, you are not welcome here. So it was a tough time for students to settle in back to their communities. They were named to be the ones indeed taking COVID to their parents. So emotionally, it has been tight. On the forums, you see them saying, I am waiting for my turn. It looks like everybody has to go. So I am waiting for my turn. And we have also noticed a lot of suicide tendencies among students. Some of them are saying, I think, Madam, instead of spending my money on paying for school fees, I'd rather drop out of school and do something sensible because school has no meaning anymore.
Yes.
Recently, a 16-year-old told me, but Auntie, I am growing old. I had ambitions. I thought by this age I would be in S4. Yes, I thought at this age I would be married. Yes, I thought now all my ambitions, all my goals have been tarnished by COVID-19. And they just stood up and walked away from the table. And I had to come back to them and say, you know, we have to accept reality. Where do we start from? We have to start from accepting reality, that this is here with us. We have no control over it. These students need to know their locus of control. What are they in control over and what can't they control? Whatever you're not able to control, you accept and move on. Deal with what you're able to control. They need to divert their mind. They need to be kept busy at home. They need to engage in other activities other than school. I have seen parents scoffing their students, even now in the lockdown. They're like, you're not reading your books, you're a candidate. But they are not sure they have lost their morale. So they need to be diverted to other activities.
Exhausting. It's exhausting
Yes.
to read.
Exactly. So they need to be involved in other activities, in housework, in games. You find parents telling them, don't watch TV, you're watching a lot of TV, go to sleep. But what used to engage their minds is no more. So if there is sport on TV, allow them to watch the TV, allow them to divert their mind on movies other than the news that is going to keep bringing in information that will scare them more. Affordability, yes. They need to know, where else can I go for mental health support other than these public hospitals that cannot be accessible anymore because of COVID-19. Others do not even want to get near to Mulago Hospital because they say it is full of COVID patients, supposing I pick it there. I will ask my colleague Grace, because she's in that field, to tell me much more of the clinics, the private clinics where students can go. I only know one clinic in the Weyogerere, that's Dr. Basangwa's clinic. And like Grace said, these clinics charge 50K for people to access mental health services, because parents are out there and wondering where to take their students. One student called me and said, I'm being charged 400,000. I have to look for it. My mother doesn't have it. And I think I am getting into beyond mild stage of depression. I need help. So I had to look for them and send them to where you get it, where it could be affordable. So Grace is in a very good sector where she has a better advice than me on where these people can get help from other than the government hospitals. Thank you.
All right. And maybe before Grace comes in, and we need to wrap this up, talking about help.
Yes,
you know, when you said I had to send my students to Boyogerere, I remember the last lockdown, because I also work for an institution that has a component that deals with mental health. And I remember we had a lot of breakdowns amongst people, and we needed to be available. And I remember there's a time that we got a suicide call, and we couldn't move because we were not essential workers. And so we spoke to one of the RDCs around, and he said, but that is not an issue.
Oh dear.
And I was like, what? And he said, yeah, that person will be fine tomorrow. So Grace, as you come and you talk to us about the facilities and possible options available, I know you can't answer on behalf of government entities, but I think we need to do a lot more work around educating people in positions of power, especially within lockdown. Also, mental health disorders at times are not the kind that you could easily recognize. You cannot measure someone's panic or someone's anxiety or someone's inability to sleep, but they are realities. And you may get locked up at the next roadblock because the officer or the RDC does not recognize mental health as a real thing. Yes, so Grace, to you. And also, as you spoke, please make your closing remarks, and then we should be able to close the show.
Okay.
Yeah.
Okay. Thank you. Thank you so much, Isabella. And thank you so much, Gladys, for all the very practical, simple ways that you've given that people can manage. Isabella, starting from what you've stopped, I mentioned it earlier, that when COVID came to this country, the government rushed to all the mental health unit in all the district hospitals. Those were the department they turned into COVID treatment centers in all the district hospitals. And when we sat under Ministry of Health, the mental health sub-pillar, we were asking questions. Now, how are they managing the psychiatric patients? If these hospitals, these units have all been turned into a COVID response unit.
Yeah.
The same scenario you had, the first lockdown, a lady sent social media from Gulu I'm going to die. I'm not going to allow to be embarrassed. I'm supposed to take care of my children. And if I cannot take care of my children, I can't. She started by a story. I had 10,000, paid boda at 3,000, where I used to pay 500. Went to the market, beans that I used to buy at 1,000, I bought it at 2,800. Portion that used to be 1,800, I bought it at 2,800. I am left with 600 shilling. I don't have any money. What can I do with the 7 children I have in the house? She said, I'm going to kill myself and my children. I don't want to be embarrassed. I will not be a mockery to my in-laws, whom when my husband died, they took away everything from me. That circulation went on a page where 2 of us clinical psychologists are. One of them tagged and said, Grace, can you send your staff in Gulu to respond to this? Lucky enough, we are under essential services. I sent a staff from Gulu who drove and went to that village. Reached there, didn't find the woman, came back. I took the initiative and I decided to place a call to the different district leadership in Gulu. May his soul rest in peace, the former RDC of Gulu district. I called him. Yes, when I explained to him, he told me, said, give me details. I'm driving there myself. Isabella, the RDC drove there with my staff. They arrived at the moment when the woman was tying a rope on the tree. And they saved that one life. Now, those were some of just one life that was saved. There's an example of like you've given. So many lives were lost in just people looking and saying, that person is just talking for attention or is just throwing tantrums. They will be okay. I want to make this clear. Isabella, if anybody mentions suicide, let's treat it as a matter of urgency.
Yes.
Even when if a child jokingly tells you and say, Mama, for you nowadays you don't like me, I will die. Don't take it lightly. Mention of death or of suicide in our practice of mental health is an indicator that there's a psychological distress that this person is presenting. So I pray that our leaders pay attention to these mental health disorders and they are addressed. Now, what are some of the structures that people can go? Isabella, one of the partners under the National Working Group, that is Strong Minds, last year set up a system that is operational and it works very fast. They have over 500 counselors that are on standby waiting to respond to the general community mental health need. All a person needs to do is you need to dial plus 256 hash on any network, and then you choose option 10. Plus 256 hash, and then you choose option 10. When you choose option 10, it will now direct you. Do you want to be given a call directly? Do you want an SMS? Do you want a WhatsApp? Whichever option you choose, a person is there ready to respond to you. Okay? That is a toll-free, free of charge. Yes. I also promise, Isabella, to get back to you with toll-free lines that partners have set up in the different parts of these countries where people can call in freely. And they are counseled and they speak to either a counselor or a social worker or a mental health expert and can address their issues. I will compile them per locations. And then I send it to Isabella so that you people can communicate it out there and publicize it for people to use. And then there's a center that I like so much. It's called International Center for Family Care. It's here in Ntinda. It does a lot of children mental health and teenagers support, including family therapy. This lady has an amazing team. She keeps coming up with campfires, work activities before COVID, where children from all walks of life come together and they talk to them. They also do organizational psychology. They do debrief for organizations. They do individual response. They also respond to universities when invited. If you have where to write, you can write her number. If you call her, she's an amazing woman. Depending on your needs, she tells us a program and sends a team to come support. She also does a lot of social media advocacy. If you go to International Center for Family Care, there's a lot of talk shows, there's a lot of recordings and videos, okay? And then not forgetting the wonderful program that Isabella, our mutual colleague, started right now. You know, what is her name? Elena, what Elena is doing. That is
yes,
also
mindful. Yes.
Yes. It's also a platform that when you listen in, you listen to those stories, you listen to testimonies, they encourage you. And they're also they respond to every questions and queries that people ask on that social media platform. So those are some of the platforms, but this is the contact for International Center for Family Care. 0772 42 54 49. 772 42 54 49. International Center for Family Care. Okay, now those are some of it, but I still echo, I will share with you 12 free lines that are set up by partners in the different respective locations, Isabella. I will send it to you after this show, and you can try to find a way to publicize it so that people can call in. Now, this is my closing remark to people. I want to say that your mental health is your responsibility. Your mental health is your responsibility. If people choose to take it upon themselves and purpose to pay attention to what we take as doesn't matter, it will improve a lot of things. Because if your mental health is upright, you're able to work, you're able to have healthy relationships, you're able to have healthy physical health, you're able to make whatever money you want, and then deal with this COVID situation. So let us take it upon ourselves and address our mental health issues on a personal level. Reach out for help. Check onto each other. Don't downplay. When a person says, I'm not fine, if a person says, I'm not fine, take time and ask and say, what's going on? How can I be of help? That is what matters. You don't need to be their relative, their friends, or know them.
Yeah.
I find myself in so many WhatsApp groups. I can be quiet like a ghost, the way they call. Then the day I see a person express that they're not okay, anger, that's when I come up and I ask, are you okay? How can you be helped? Okay, so that's how I want to close. And I want to say thank you so much to Civic Space TV for providing this opportunity for us to discuss. I would like to request Civic Space TV to give more time to mental health discussion, because this can also be a platform where people can understand and get where they respond from. There are so many experts there who are open to come. Isabella, if you reach out to me, I can always recommend from psychiatrists to psychologists to social workers and counselors that can give you professional discussion. Thank you so much.
Okay. Thank you. And our time is fast spent, and so I need to bring this conversation to a close. To Gladys and to Grace, it's been an absolute pleasure spending the last hour with you. Thank you for sharing your knowledge. Thank you for sharing your time with us, but also sharing on mental health, which is a very key conversation that we must have as a country and also as a people. One of the things that my physician told me, and I'll close on that note, that he told me when we were having conversations around seeing a professional mental health specialist, was that, Isabella, you comfortably walk into my office for any other medical issue. So why can't you comfortably walk into the space of a mental health practitioner to just make sure that your mind is fine? And so as Ugandans, we must realize that checking on your mental health, going to see a mental health practitioner should be as normal as going to check whether you have typhoid or malaria or why your tummy is upset. It should be the same normalcy that you carry to their offices. But also remember that mental health disorders are real. Remember that because of the pandemic, there is a lot of stress out there, and so it's triggering a lot of mental health disorders. So be kind to yourself, be kind to the people that you love, be kind to your family, but also check in on them, because we are all struggling with this pandemic and all of us are responding to it differently. And do not forget or be embarrassed to seek help. The toll-free lines shall be available on our social media platforms, that is on Twitter. And so feel free to go and check out Civic Space TV, and you will be able to find the toll-free lines right there. But also, in case you need any further support, inbox us and we should be able to get you in touch with either Gladys or Grace or any other practitioner that should be able to help you. So don't go through it alone. Don't go through it alone. It's important that you have as much support as you can have. Otherwise, thank you and have a blessed week from us at Big Space TV. And on behalf of the panelists, thank you for joining us. And Grace and Gladys, once again, thank you very much for joining us on this show. Bye-bye.